Hello and welcome to another short video of Dr. Barbara Miller's NCLEX review, or the State Board of Nursing review. Today we're going to be focusing on pregnancy complications. Okay? For example, the patient may have a pre-existing condition such as hypertension and diabetes, which places the mother at increased risk of developing complications during pregnancy. Women who have had more than 4 pregnancies are also at risk for higher complications. Let's start with gestational diabetes. Abnormal glucose tolerance due to decreased effectiveness of insulin during the second and third trimesters. High BMI is also a risk factor. If left untreated, it can lead to polyhydramnios. Polyhydramnios means excessive amniotic fluids or macrosomic fetus or large fetus, as well as preeclampsia, neonatal hypoglycemia, and also respiratory distress. The next complication is that of gestational hypertension. Development of hypertension in a normotensive client without proteinuria. Okay, blood pressure returns to normal by postpartum day 10. They also will be contraindicated to give methogen. Methogen should not be administered to patients with a history of hypertension. Okay, they will experience postpartum hemorrhage, so they would prescribe methogen for that patient. However, they could resort to other medications such as Pitocin or Hemobate. The next complication is that of preeclampsia. Preeclampsia occurs after the 20 weeks of gestation. So preeclampsia is pregnancy-induced hypertension that includes proteinuria. Patient will start spilling protein in the urine and edema of the face, the hands, and ankles. What are some serious symptoms? Blurred vision. So they do have mild preeclampsia, okay, where the blood pressure 30 will elevate 30 millimeters of mercury in baseline systolic blood pressure, and 15 millimeters of mercury rise to baseline in the diastolic blood pressure. This can progress to eclampsia. Eclampsia is the severe form of preeclampsia where the patient could start having seizure activities, okay? Risk, African American and young primoparous had a higher risk factor as per evidence base. Treatment is magnesium sulfate given to lower the blood pressure and work as an anticonvulsant. When the patient is receiving MAC sulfate, calcium glutamate, that's the antidote, should be at the bedside. Then you have your placenta previa. Placenta previa or partially covered the cervical opening, okay, or the placenta can be implanted low in the uterus without covering part of the opening. What are the symptoms of placenta previa? Painless, red vaginal bleeding, okay? So patient needs to maintain bed rest. Then you have placenta or abruptio placenta is separation of the placenta from the uterine wall, which cause severe bleeding that is accompanied by abdominal and lower back pain. So with abruptio placentae, the boards may say the abdomen is hard like a board-like abdomen, and you know they're referring to abruptio placentae. Blood will be dark in color. Mothers are more likely to have an infection or a hemorrhage. This is a life-threatening situation for both mom and baby because the fetus will be deprived of oxygenation. They will end up with uterus placental insufficiency, meaning not enough oxygen going to the fetus. Then you have incompetent cervix. Incompetent cervix dilate prematurely because it is unable to support the weight of the growing fetus. If left untreated, an incompetent cervix may result in spontaneous abortion. Okay, never perform vaginal exam in the presence of unexplained vaginal bleeding. Treatment, placement of the purse string suture or cerclage in the cervix to close it. Then you have breech position, major complication of breech. The breech could be footling breech, or it could be a shoulder, okay? Anything different from a vertex position, okay? So you want to place that mom in a knee chest position if the 1 foot came as the presenting part. So vertex presentation, you want to check the fetal head tone, the fetal heart tone below the umbilicus, right or left lower quadrant. And breech presentation, you want to check fetal heart tone above the umbilicus, right or left upper quadrant. You also have another complication, also known as hyperemesis gravidarum. And what is a hyperemesis gravidarum? Is excess and persistent vomiting during pregnancy that results in dehydration and electrolyte imbalance. So the solution for that is to admit the patient and for at least 24 to 48 hours for hydration. Additional pregnancy complication, bleeding from the vagina at any time or uncontrolled leakage of fluid, unusual abdominal cramps or pain, persistent nausea or vomiting, especially in the second and third trimester, persistent headache or blurred vision. It could be indicative of preeclampsia or eclampsia, swelling of the ankles, the hands, and the face, painful burning on urination with chills or fever. Thanks for watching this short video on pregnancy complications. Please like, share, subscribe to the channel to help it grow. And thanks to all of my subscribers and my viewers for their support helping to build the channel. Thank you so much. See you in another video.